Good morning. Today I would like to just introduce you two of our pharmacists from Canada, and we are going to talk about the role of pharmacists in providing vaccines in the pharmacy. We have Jen from Canada as well as Selina, and they will just talk to us today about the scope of practice in the country. Thank you, ladies, for coming. If you could just kindly tell me a few words about yourself.
My name's Jennifer Wiebe. I'm a pharmacist from Canada practicing in Alberta. I work primarily now within the hospital system, focusing on medication safety and patient safety.
So my name is Selina. I'm a pharmacist from Canada, and I specifically practice in Ontario. And my focus is more in academia and research.
Fantastic. So we are going to ask you a few questions now about vaccines, but first I think the most important thing will be about education, because this is actually what really interests me a lot. And when did you learn to do vaccines actually?
So I learned within my school curriculum, it was mandatory to get the vaccination training. So within our classes, together with our classmates, we learned the theory behind the vaccination, but also the practical aspect. So we were able to practice administering vaccinations. And then that really prepared us well for our career as pharmacists because it was integrated into the school system.
Fantastic. So you just mean that this is a part of education program?
Yes.
Oh, this is very good to hear. Fantastic. Jen, how about you?
I had gone through school. It wasn't offered as part of my curriculum. So prior to my clinical doctorate, it was mandatory that I obtain training. So it was a combination of nationally approved modules online and then a one-day in-person 8-hour workshop to gain practical skills that was taught by a third-party kind of provider. And then that learning was submitted to my college, and then I was sent my license to be able to administer vaccines.
Super. Can you tell me a few things about scope of practice about vaccinating in pharmacies? When did it start really in Canada?
So within my specific province, it happened in 2012 when the bill was passed. And so basically there was an expanded scope that was introduced for pharmacists, and providing vaccinations was one of them. And so as a result, pharmacists have to go through certain training to be able to provide that, but it's fairly normal for the pharmacist scope to be able to vaccine.
Okay, that's very good. Thank you. Just a few questions now. What are the benefits of vaccines organized in the pharmacies, in your opinion?
So the benefits of providing vaccination in pharmacy, there's many, but first is to empower pharmacists to kind of be more active in being a true healthcare provider. The other is a contribution to public health. We all know that vaccinations are one of the mainstays of decreasing communicable disease. So providing that service really helps garner support from the public and helps enhance the healthcare of the public. The other part of this too, I think, is that pharmacists probably truly feel part of a healthcare team when they're able to support similar competencies that a nurse and a physician were able to deliver. And for the public, it's an access issue. So getting yourself to an influenza clinic that only operates during certain hours on certain days of the week can often be limiting to people. So in an effort during influenza season to vaccinate as many people as possible, the fact that you have thousands of pharmacies offering access points within a city or within a province helps the population actually obtain the service that they need.
So what do you think, what are the gains of the system when we introduce the vaccines through the pharmacies? What are just the system benefits?
Well, overall, you see a concept called herd immunity. So that really helps from the public health perspective, the overall health of the population. And I think that, again, as Jen mentioned, it's really easier for patients to see pharmacists as opposed to going through other clinics. And it helps the patient establish a good relationship with the pharmacist. So it's almost like a domino effect. So if the patient establishes that relationship with the vaccine at first, then the pharmacist will be able to provide more expanded scope services, and the patient will be able to trust the pharmacist more in providing those services.
This is a really great answer. My question is actually related to those things you just mentioned about. Let's talk about measurables effect. For instance, if you know any statistics about like helping to prevent certain pandemias or problems in general through the pharmacists and introducing vaccines over there. Any ideas?
I don't know if I have any statistics to offer you offhand, but we do know provincially now where we used to run 30 vaccination clinics during the flu season. The city that I live in is down to just like a handful of flu clinics because we have pharmacists available. And I think you might not even just look at statistics for vaccination specifically, but when you take away that competency from physicians who are taking their clinic time and actually allow them to spend more time managing chronic disease, which is a huge health burden to the system, you can't help but think that there has been efficiencies introduced into the system because of the role of pharmacists administering injections.